It's 8 o'clock, and it's so good to see all of you at the intersection this morning. I'm having a little audio difficulty, so I'm doing the audio through my phone. So if you see my name twice, that's why. So we make the technology work no matter what, right, Billy? Yeah, we figured all the little tweaks out. So for those who don't remember and don't know, these are recorded every week and posted on sacred.org. And you can go back into them at any time. In fact, new people who come into town and ask, want to get involved, right? I say, you just go to this link and you can watch 10 to 15 minutes download on any of those topics and get to know people, get to know who you need to call about whatever. And it's really, I think, one of the best introductions or trying to, get up to date on what's going on. So I'm sure that Billy will post that several times in the chat, so you can use that. And particularly in this conversation, Cathy, you'd be able to use that link and others for getting the word out about the efforts. Just watch these 10 minutes between 8:05 and 8:20 or whatever it says, right? So it'll be a real useful tool. And others within congregations and organizations, you can use this tool to tell your organization instead of trying to remember everything that Cathy says. You can just show them the 10 or 15 minutes, and they'll get more detailed information than you might be able to filter on your own, right? So first, we're going to start with just a couple minutes of announcements. I know that Doug's going to want to announce something thing coming up. I'm teasing. It's very serious. Go, Doug.
I just put it in the chat. Pathways to Hope is August 22nd and 23rd. And the link is in the chat that you can register for the conference. It's Friday and Saturday, the 22nd and 23rd. It's free. CEUs are offered also for free. Saturday is a special day. We're going to focus on youth and the adults that work with youth, parents, coaches, counselors. So I hope everybody will attend. There's something for everybody.
Great. And I encourage you, and it doesn't take long. In these next couple minutes, you can go ahead and click on that. It won't bother me a bit if you register while you're on the intersection today. And I'd really like to see as many of us there as possible. Other announcements, things that are coming up. I am going to start announcing, and I'll do that right now, the Festival of Faiths in San Antonio. This is the second year that's happened. We got the idea from Louisville, Kentucky, where they've been running it for decades, and people travel from all over the world to attend. But we're in our year two. It's coming in September. I'm going to have to look up the exact date. It's a Sunday afternoon and the registration, and I'll put that into chat. So start thinking about it. It was really beautiful last year. A very mix of information and culture and music and dance and storytelling and just learning about and celebrating all the different faiths that are in our city. So I do see that Cathy went and put into chat hillpalestine.org for volunteers. And I'm sure that she will also be telling us what those needs are with the family that is here in town currently. So we're going to start on the early side, get as much out of this as we can. It's 8:04, but Cathy has worked with us also before when Dr. Iseldine was in town and was speaking to hatred as a health issue. The host would like me to unmute my microphone. Sorry about that. I don't know how to do that, Billy, but I do want to take care of technology. But she served on a doctor's roundtable discussing hatred as a health concern and what that does, not only between us as people, but within us as humans and what that produces. And it was specifically around the conflict and things that are happening in the Holy Land. So, but Cathy does this kind of work on a daily basis. So, Cathy, I'm going to hand it over to you. Thank you for being with us, Doctor. And I'm looking forward to hearing about the family, how we can help, how this all came together. Thank you for being with us.
Thanks, and good morning to everybody. Nice, I see a lot of familiar faces, so that makes it really comfortable to be here with you. So I appreciate you wanting to know. For most of us, we've been standing around watching the news, wringing our hands, going, how can we stop this? How can we do something positive? How can we change what's going on? And a lot of times, as in many things that involve a lot of politics and higher ups, there isn't anything just Josephine average can do. So, but in this case, we've got some stuff to do. So Monday morning, our boy from Gaza, Anwar, he's 14 years old. He arrived into San Antonio. He was in Gaza at the beginning of last week. And so you can just imagine what the transition was for him to go from being in a war-torn country for the last 2 years, almost 2 years, and then just suddenly coming to San Antonio and being welcomed. He was injured on September 2024. He was on the street. An air raid happened. Things were falling. He was running through the street to try to get away from the falling buildings and debris, and he got hit by a truck. So really kind of sad circumstance of that. If you can imagine, it was September, so it'd been a year of war in their country. The infrastructure, healthcare infrastructure in Gaza is just demolished. There are no fully functioning hospitals anymore. There are clinics, there are hospitals that have certain areas open, no full service, no very little equipment, hardly any medications. And so the treatment that you and I have come to expect in the United States for a child who might have had a really badly injured leg would have been to go to the hospital, have surgery right away, these external devices placed, support, antibiotics, pain medicines, everything he would need to get better. And he would have most likely saved his leg. But in Gaza, the healthcare was gone. Very limited antibiotics, though I saw on his records that he did get some IV antibiotics for a few days. But once the infection had kind of overcome things, he didn't have that. They didn't have the ability to do anything more for him, and so they took the leg. He didn't stay in the hospital long. There were no pain medicines. He got Tylenol for pain, or acetaminophen there. Paracetamol is what they call it. And that's all he got for pain during his whole time he was in the hospital. And he also had a fractured left arm. So have any of you ever broken bones? You can imagine how you would feel if all you got was Tylenol. It just is kind of beyond me how a 14-year-old would have dealt with that. But he did survive. He went home. There's no outpatient care. There's no equipment. There's no OTPT, no home care, nothing. So he had crutches. But because of his arm, he wasn't really able to use them very well. And so he basically sat at home in a tent, which is where they were at that point, in a tent. And fortunately, somebody from HEAL found him and the family and put them under their umbrella. And once you're under HEAL, Palestine's umbrella, it's the golden ticket actually for the kids in Gaza. HEAL Palestine is an organization that started in January of 2024 by people, the Sosbee's, Steve Sosbee, who had been working in Gaza for over 30 years with another organization. And then when the war started, it was clear that the other organization was focused on children's health, and it wasn't going to be broad enough to take care of what was happening in Gaza then. So he formed a new organization, and this new organization, HEAL, has people in Gaza right now that have been there since the war started. They've set up clinics, they've built hospitals, they've helped with the World Central Kitchen there to provide cooks and stuff for that to go on. They've done pop-up schools for the kids. So they hire the teachers there in Gaza to start school. So not only have they kept the kids trying to get them in school, but they've also hired people and they have jobs. And so they're doing those kinds of things, and then they're building leadership. So all their people in Gaza are people from Gaza, and they're providing leadership opportunities for them as well. So it's a really well-rounded organization. And one of the things they do, because I'm a healthcare provider, I'm focused on that part of it. I'm on their health advisory board, and we are one of the big things they do is bring kids outside of Gaza when they can get them out into other countries for care. And you can imagine I can't imagine how hard it is to get a kid out of Gaza. The logistics, the people you have to get permission for, the waiting, all of that. He was injured last September. It's been almost a year, and they've just got him out. He came with 10 other children. It's the largest group of children getting out of Gaza at one time to come to the United States. So 11 kids that came into the United States this week. They have to be released by the IDF. So that means all that has to be done. And that holds up a lot of kids because they'll approve the child to leave, but not the parent or not a caregiver. So when the child applies and the mother applies and they don't let the mother out, then the mother has to find somebody else that maybe they would approve. So an aunt or an older sibling or somebody. And sometimes the kids come by themselves because they can't find anybody that they will be approved to come with them. On the way out, the kids that had bilateral amputations that were in wheelchairs, their wheelchairs were taken, and they weren't allowed to bring them with them by IDF. So there's a lot of that kind of stuff going on to make it miserable as miserable as you can make it. Let's make it that miserable so maybe they won't leave or maybe they can't leave. But these kids got out, and Anwar is here. He's in San Antonio, which is really exciting. It's the first child that's come to San Antonio from Gaza through Heal Palestine, or through any organization, actually. We have a whole group. Many of you in this call this morning are on that volunteer group. I think the number's up to like 90 volunteers. It's a lot. And we have divided up into responsibilities, and I'm responsible for all his medical appointments and medical care that he's going to get. And then we have people who are responsible helping us with transportation to get him to his appointments and those kind of things. We have people dedicated to fun. So people getting tickets. Janice was able to get us tickets to the museum. We have tickets to Morgan's. We're kind of working on things that the family would like to do. He went to a farm yesterday, one of those petting farm zoo things, and had a lot of fun doing that. So we're providing that kind of opportunity. We have a meal train set up. So families are bringing food to the host family. And we have a beautiful host family that has been amazing and are continuing to be amazing. You don't have to speak Arabic to be a volunteer. I don't speak Arabic. I have a couple of words and that's about it. But that's why God created Google, Google Translate. I'm going to be using it like crazy. And then we have students at the schools. So UT medical students and nursing students who happen to speak Arabic, and they're volunteering to be translators for us. So it's actually really pretty wonderful. This is the website for Heal Palestine. So those are kind of some of the things that you could do now is go to this website and volunteer. Anybody that volunteers that signed up in San Antonio, those come to us, and we put you in our list. And if you have anything in particular, like you can get tickets to SeaWorld, let us know. If you can, if you have an idea of something fun for the family, let us know. If you volunteer and you're on our list, then you will also find out when we're doing community events. Now, the family's not ready for that just yet. We've had a lot of calls for media interviews and things like that, and the family's just not quite ready. They're asking not to do it yet. Our host family is in the middle of their own immigration procedures. And so they don't want anybody to know who they are, and they don't want anybody at their house, and they're not giving their address out. I don't blame them one little bit in this environment for doing that. But so that's kind of, those kinds of things are being kept low key for right now. When Anwar and his mother are ready, and if they want to speak to the press, then we will, make that happen for them. And we'd like to, because any support we can get them, we'd love to do that. But that's their call. This is tough times for them, and I can't even fathom how it would be. The only thing that we haven't started, we've got all the medical stuff. He goes today for his prosthetic appointment. He has a wonderful medical team at university and at UT Health. The Wellness 360 clinic just opened him and said, just bring them, we'll take care of them. And then the orthopod, Dr. Gibbons at UT, has agreed to take a look at all his orthopedic stuff and see if there's anything he needs. There's a group that's, if he does have to have surgery, there's a group that's going to take the cost of that on for him. And so, San Antonio, thank you. You guys have everybody has just opened their arms and been unbelievably warm and welcoming to this family. And he's going to be here a couple of months, most likely. If he has to have surgery, maybe a little more, but getting his prosthetic for his leg and learning how to use it and gaining weight, because all three of them are just very, very, very thin, below weights for their age and heights. So we're going to work on that. And I hope we've covered our bases. If anybody thinks of something, mental health is a big issue that we are looking for a mental health provider that speaks Arabic, and it would be lovely if they were Palestinian too, but not necessarily. We just want to do some cultural things for this family, and that is fully informed on trauma-informed care for mental health. So we are in the process of looking for people like that. If you know of anybody, I would love to get that information from you. Do you have any questions about what's happening with Anwar and how you might be able to help or heal Palestine? I've been working with them. I've worked with Steve Sosbee for the last 15 years. I've been back and forth to Gaza and the West Bank many times doing medical care. So it's a second home for me. And those people there are my friends and colleagues. So I'm really terribly disappointed in what's happening there and how our country has been involved. But what can I help you figure out?
Well, one of the things and this is how the intersection works as well, but Doug Beach, who announced earlier the Pathways to Hope Mental Wellness Conference, he's the executive director for NAMI San Antonio.
Oh.
So I'm sure, and as you mentioned, at that conference this year, which is near the end of August 22 and 23, there is a focus on young people, and I'm sure that Doug's folks will be able to help in terms of the mental health concerns and make those connections in community, because that's what NAMI is all about. Mental wellness, but community being a part of that, and also knowing and getting mental health care to people. So I don't know, Doug, you might want to, in chat straight to Cathy, give her your phone number or whatever you need to do, make that connection. So okay. I'm curious, Cathy, if you know how many, so did you say that Anwar was the first one to come to the United States in this way?
Not the first one for the United States. He's the first one to San Antonio.
In San Antonio. So
they brought other kids. This year we had about 35 kids in the country, coming at different times. But this is the big group, this 11 kids all at once coming to the United States for care. And it is our first patient in San Antonio.
Yeah, that was my question, was really how many have made their way and are here. So
yeah,
important work, and focused on children. If only we could focus like everything on children, it would perhaps refocus how we approach our human needs and care and compassion in the world. If we would, when it comes to war, or when it comes to immigration, or it comes to housing or education, just name it. If we focused on the children, we might go about the work and our approach in much different ways. So others, do you have questions or thoughts?
There's one in the chat about who else came with Anwar.
Yeah, so Anwar's
Thank you.
14. His mother was able to get permission to come out, which this is the one that took him, why it took him so long. They originally would not allow his mother to come, and she wasn't going to let him go without her. So they applied again and got clearance. So his mother is with them, and then they have a 6-year-old sister who appears to be, other than being malnourished, appears to be and need a dentist, appears to be healthy. So the three of them did come together. They did leave their father in Gaza, so they're very, very worried, of course, about his safety. And he has other brothers and sisters who are older, and they are all still in Gaza. So it's not it's hard to. We would have thought that they'd be so excited to be here, but they're really so worried about their family that it's hard for them to, and they feel guilty because they're having this wonderful, safe time to have plenty of food, nice, warm place to sleep and safe, and their family's not safe and not eating.
Mhm.
So it is very difficult for them.
You do also know that Christian Dental, which is down at Haven for Hope, but
Yeah.
it's open to the public. It's not inside Haven for Hope, so you might
We have
sidebar.
dental. We have a dentist, a woman
Great.
who's a Palestinian American, and she has agreed to see the whole family and no problems. So we have a dentist lined up, and we have an eye doctor lined up. We'll go get their eyes checked, and while they're here, we're just going to see if we can just envelop them in good health care, get their vaccines, everything.
What great stories, right? About community itself
Hmm.
becoming a collaborative and
Yeah,
working together, right?
exactly.
Martha Ann has her hand up, and then Julie.
This is really good news, Cathy, and I am going to share it with my friends in the Middle East. And I think, yeah, well, you do know that Julie and I, for 3 weeks in May,
Yeah.
were there. We could never connect with you, but it was just good that we were all there. And when I say I'm going to share this with my friends, I am in a WhatsApp chat group, the Women Wage Peace International Supporters. There are 50,000 people, men as well as women, who have aligned themselves with Women Wage Peace, Israelis. There are 50,000 Israelis who say, we want peace. So in their chat, they're always posting good news. And I'm going to say, Anwar, a child getting help, that's good news. And recently they had a picture of 2 young men in Gaza holding pictures of hostage children to build empathy for Israeli hostage children. So I think the more all of us in the world say, we care about the children being safe, we care about each other, we don't want anybody to be suffering.
Right. Right. I agree.
Thanks, Martha Ann. My question is kind of off of that one, but when they get home, what is their health care? I mean,
Yeah.
but also how could organizations like Women Wage Peace link up and support in some way? Is there anything like that?
That's a great question, Julie. Thank you for asking it. There are, what Heal doesn't just get them prosthesis and then send them back to Gaza because they realize that there's no follow-up, there's no help, there's no food, there's nothing. So they actually go back to Jordan. Heal Palestine has bought a apartment complex and is housing them. And the kids go to school and they're supported financially and also mentally and healthcare wise until they can safely return to Gaza, which won't be until the war's over and they have some rebuilding. So it's going to be this is long term. And that's what's different about Heal than some other organizations. They kind of, get them their prosthetic and then bring them back. And the prosthetic breaks and there's nobody there to fix it. And they don't go to school. And so this is something that I think was really wise, the way they started this organization and they are supporting these families until they can get back into. And I have been to Gaza and taken care of some of the kids that that they in the past were taking care of, and they still follow them. They don't, once they come back, they're still on their list. They still check in on them. They still make sure they're getting their care and things that they need. So they won't just dump them when they're finished here. They're going to continue to take care of the whole family.
I know one of the things that, and not just in San Antonio, that people struggle with, besides the whole mess of it all, is trying to figure out, what can I do? And I know you've already talked about specific volunteer opportunities in this particular situation.
Yeah.
I don't know exactly what my question, and my question is a little deeper than just even, what are specific things. But I think my question more, Cathy, is how did you figure out what you were going to do? And now I know you've been at it for years.
Yeah.
But what fueled that
Yeah.
that you wanted to do?
Yeah.
And then how did you figure out what you were going to do, and what causes you to continue with that? It's the deeper question.
I'll be honest with you. When I'm a nurse practitioner, I have skills. And the very first time I went on a medical mission, it was not to Gaza, but it was to Mongolia. And somebody was going and they needed, a nurse. And they said, would you mind going with us? And I went, oh, yeah, I'll go. And then I ran to the map to see what in the world is Mongolia? A city, a country? What is Mongolia? So I didn't know enough when I first started. But once you get there, so it doesn't matter what your first, in my book, it doesn't really matter what your goal is that first time you get involved. It doesn't matter. If you say yes to something, even if you're kind of nervous about it or a little bit afraid, and you say, yeah, I'm going to go ahead and stick my neck out. I'm going to go. Then when you meet those people and you realize that the world is so small and that everybody wants the same thing. We want our kids safe. We want our kids dressed. We want our kids to school. We want them to have a happy life. We want our family to be safe. All of us, the whole world, we all want the same thing. And I think that's what, for me, is my driving force, is that how can I help all those people that don't live in the privilege that I live in? What can I do to help? And as a nurse practitioner, I'm lucky. I have this great skill set that I can offer. But everybody has something to offer. And they just have to say yes. And even if it's a little scary, or you're not sure how it's going to be received, or you don't know if people are going to be friendly, or if you're going to get a thank you or any of those things, you just say, I'm just going to go ahead and try it. So offer a meal. Say, I'll take him to his next doctor's appointment. I can write that letter to the senator. There's little things you can do, and then there's big things you can do. And it always starts with the little things. Take little baby steps. Just say yes the first time. And then you can't say no ever again. You just keep.
Well, and even if you end up just doing the little thing over and over again, but writing authentic letters to senators, and you just that's your thing, right?
Yeah.
And that they're real letters, and they're informed, that whatever the concern might be, that is important. And it's not a little thing, it's a big thing. And not everybody are letter writers, and not everybody are nurse practitioners, right?
Right.
So I'm thinking one at 8:29.
Okay.
That maybe if you haven't already, if you would go ahead and put in your contact information, if you're open to that, and having people connect with you. But I also know that Julie and Martha Ann, who are on here, also are doing efforts. And Julie and Martha Ann, if you would put your information in as well. So people who are really wanting to get connected more, have people of contact. That's what we do at the intersection. And then maybe Martha Ann, if you haven't already, maybe you could talk just a little bit about the friendship dinners that that the community is organizing and coming up this fall. But I want to thank those. It's 8:30. So for those who need to leave and get on with their day, thank you so much for being with us. Next week, our guest is going to be Christy Alcazar, and she is with the Pathways to Hope Mental Wellness Conference and responsible for coordinating the youth focus of this year. So she's going to be coming next week with Doug, and they're going to dive deeper into that. I would encourage all of us to be thinking if we have a youth group or youth minister, or, get a group to go together. Even if it's one or two young people, that's great. It's better than zero, right? But the more that we can get there to get this kind of information, that too grows and develops community as well. So make sure to come next week and hear more in-depth information about the youth focus for Pathways to Hope, and don't forget to register. So Cathy says she can stay on, as long as we want, but we're going to stay on until about 8:45 for anybody who wishes to continue. And I'm wondering, Martha Ann, could you say a little bit about the friendship building? You've corrected me. See, this is a new idea. I haven't gotten the lingo down yet. So the friendship building meal. You have some details. What is it about? Maybe we don't have like who, what, when, where, but what's the thought behind friendship building meals, Martha Ann?
And the idea's been building for a while, but when a UIW faculty person, and I will say it, from Serbia, expressed how frightened she is, it just really pushed me. Okay, Martha Ann, stop just talking about this and get things in place. So any of you who are here today can sign up to be part of a meal, and it will be 6 people to 15 people. It's a little hard to talk if you have more than 15 people, and it will be 3 different faith groups. So let's say you are in this group and you are a Mandean. You get 1 more Mandean, or maybe 2 or 3 or 4 more Mandeans, and then 2 other groups. Could be Christian, could be Jew, whatever, but it's going to be 3 different faith traditions, and it's going to be from 2 to 5 people. And you can just say, come over to my house, or maybe you're like me, your house is not clean. You say, I just like a space where we could have our meal. So we think, or we hope, that different faith groups might say, our big hall, a big Lutheran church hall is available on a Sunday afternoon, and you could come there, bring your food. Now, thinking about food, this is not all in place, but we're building with Pasha's. We think that we would be able to go to Pasha's and get a discount or get some takeout food from them. And I see my buddy Mark Wittig. He's been in on these conversations. We're trying to build this. Maybe he would even give his wonderful executive book review space as a place to meet. Who knows?
So in that group, Martha Ann, because how things come together is just as much the story as what happens, right? But the group that's been working on this, from what different faith traditions are in that group, that speaks to, the desire in the community and hope.
Okay, this time of the year, people are coming and going from vacation, so we've not all been in the same room, but we've got big interest from Temple Bethel and interest from the Muslim community. And years ago, I taught a class, The Holocaust Never Again. I had a wonderful student in that class. He came on a Holy Land study tour with me. We go to the same church. He's very interesting. He feels like we need to build friendships. We need to build conversations.
Mm-hmm. So there's not just a little thing, right? It's a really great example about what we can do, mm-hmm. and builds relationship. And we all know it's relationship that restores our who we are, our humanity, getting to know each other from different traditions, sharing our food together. When we do that, we share our hearts. Yesterday, I was in another whole conversation, but it was on collaboration and community. And I might be able to remember the poet's name. I was introduced to a new poet. And well, one of the statements from her poetry was that when she died and they do the autopsy, she hoped that her heart would have stretch marks on it. Only a poet could say something like that, right? That it had given birth so many times to love, right? And you know, that's the kind of thing that we're calling forth from humans all over the place. You know, can we stretch our lives open enough, right, to even stretch even more into love? Yeah, I don't know where that came from, other than I'm still taken by that image and that thought. My father always said, I just don't understand why people can't love each other. He said that more than anything. And in fact, it's on his headstone, you know. But, you know, if we could figure that out, right? And if we focused on children, it's not rocket science. Right?
Can I just ask, Martha Ann, yeah. I assume that people of different faiths are invited to these meals. And if so, how do they engage? If they don't have a group of their own, can they engage and go to the Lutheran dinner? Or
no, it's not a Lutheran dinner. It's right. A UIW outreach program where you have a chance to meet strangers. But every time it happens, there's always going to be 3 different faith groups in the room.
And it can be 3 different kinds, Julie. So, you know, Buddhist,
That's
Hindu,
what I thought.
Baha'i.
I was just wondering how they connect. They'll connect through UIW.
Well, they'll mostly connect to the 3 people who are inviting people. I mean, it's just going to be
relationship. I'm going to get up. I think I can get the registration form up today. So you click register and you put in your contact info and it says, what faith tradition are you? And you put in Christian. And then it says, would you gather the 2 to 4 other Christians? And, you know, this could be a spouse and 2 teenage children. Or it could be like Mark, my friend, unmarried. He could just get 3 of his buddies from our church. And then my Buddhist cousin, the Thich Nhat Hanh people, she could sign up. She could get a few of her Thich Nhat Hanh Buddhist friends. So that will be the way it works.
Yeah.
Thanks. Got it.
So let's go back to Heal Palestine and Cathy while she's still with us. We've got about 6 minutes left. Do we have any other comments or questions for Cathy? I have gratitude for Cathy. Or any last words to Cathy that you want to share that you might have forgotten?
I'm grateful for Cathy's husband, Scott, who at Oblate again and again and again and again would get us together to learn about different faith traditions. Behind every good woman, there's a good man.
He is a good guy.
He's okay. And he's more than okay. There also was a workshop this week, and I'm trying to get a recording of it because it was Monday, and I heard about it on Monday, and I couldn't get the the information out quickly enough. But from the Jewish Federation on a conversation that they were having, and so I'm hoping that there was a recording of that. Because if there is, I will also be sending that out to the intersection so that we can also get some information from another direction on what's happening in their work as well. But I love the work of the Women Waging Peace, and, you know, where we're working together. Is there much within Heal Palestine in terms of Israelis working with Palestinians in that effort, or how does that look?
It's completely a non-religious, non-political organization, so they don't really talk about that. But because I'm on the health advisory board, there are a lot of Jewish physicians that are on our advisory board who are not being allowed into the West Bank and right now, but they still are volunteering their time for consults. So if somebody from Gaza has a child that they're worried about, they contact us on HEAL. We contact an advisor or a physician or somebody in the United States to consult with them. So we've made those connections. And so, yeah, there's some under the covers work going on with not open to and not even advertised, but it's there.
Mm-hmm. And that's such an important part of the story too, right?
Right.
And that's people who are focusing on the children, and that breaks down the barriers, and the challenges. Once again, anyone else? Last questions, comments? Well, thank you all for being with us this morning. And we'll be meeting again next week to hear a little bit more in depth about Pathways to Hope Mental Wellness Conference, August 22nd and 23rd, especially the youth focus and what's being planned there. Some really exciting things. We were all young once. And in fact, this week, I know there's something about aging this week. And I got this button last year, and it says successfully aging and living in San Antonio. Aging. So cool. Everyone is doing it. But not only that, we're all aging, and we were all young once, and we all know young people. And so into our future, I encourage all of us always to focus on our children. And just thank you all for doing what you're doing. And thank you, Cathy. And thank you, Scott, for supporting her. And thank you, Doug, for doing what you're doing. And thank you, Mark and Julie and Martha Ann and Adiba. We can go down the entire list. Thank you all for the work that you're doing in San Antonio and beyond.
And in the chat box, I posted again the link to the article, A Compassionate City Responds. And so Cathy was so great on that panel of healthcare professionals. How do we respond? Hatred is this terrible disease spreading around the world, but we are the people who compassionately, lovingly build humanity and friendships. See the article.
All right. Thank you, Martha Ann. Everyone have great days and a great weekend, and we'll see you next Thursday at the intersection.
Thank you.
Hey.